Hello everybody, it's Dr. Alan Bauman from Bauman Medical Hair Transplant and Hair Loss Treatment Center, and we're here today live, actually, in Denver at the International Society of Hair Restoration and Surgery 32nd Annual Scientific Meeting. I'm here at the JuveXO booth with Dr. Rafael Gonzalez, and we're going to talk a little bit about cell therapy, exosomes, how we use those therapies and treatments for hair, and anything else that comes to mind. What do you think?
100%. Thank you very much for having coming out here, having us out here, and we're going to talk about cell therapies. We're going to actually, more than anything else, talk about JuveXO and the JuveXO hair. That's why we're actually here. It's essentially a product that's been developed with years and years of research and science behind it, and Dr. Alan Bauman actually uses it. I've seen some phenomenal results following hair transplantation and following other different modalities. Actually doing a clinical study right now too on it, which is completely interesting too. So come check us out. If there's particular questions that you want answered, we're here to help.
Doctor, I have a question that just came in. Can you explain what exosomes are and how they work in the context of hair restoration?
So an exosome is basically a bioactive microvesicle. Think of a nanoparticle that contains particular information to stimulate a response or to cause a physical change. In the context of our JuveXO hair product, the concept was done simple is it comes from an umbilical cord stem cell lining product. So these are culture expanded cells, mesenchymal stem cells that have properties of such. And then what we actually do is stimulate the cells to secrete out healing cues, growth cues, things that can help stimulate follicular hair growth.
Yeah, I mean, that's what we're doing here. There's about 600 of us, hair transplant surgeons, and we're just trying to figure out how to help people grow more hair, keep the hair that they have, and restore the hair that they've lost. And so anything that we can do, and for many, many years, all we had were pharmaceutical interventions and surgery, but using regenerative medicine technology like this, cell therapy, stem cell treatments, exosomes, we now have other options and other alternatives for patients. And so JuveXO H has been amazing.
Yeah. What have you seen so far when you actually used the product? Can you tell the audience a little bit about what you've actually seen?
Yeah, so we've been using exosomes for a number of years, dating back at least probably 10 years or so. But I got introduced to JuveXO through the CEO, Brian, and he needed and wanted a hair transplant. So we did a procedure with him, and he says, listen, I've got these exosomes I want to try during my procedure. So we applied the exosomes. During his procedure, we actually soaked his grafts in the exosomes, in the JuveXO, and applied it as a healing therapy immediately following the therapy, following the surgery. And what we did was everything else normal. An FUE, follicular unit extraction hair transplant procedure, probably about 2,000 grafts or so, front to crown, and off he went. And I'm like, okay, I'll see you in about, let's say 6 months. We'll start to see some regrowth. 9 months, we'll see a little bit more, and take about a year to get the final result. Well, I run into Brian about 3.5, 4 months after his procedure at a conference in Vegas, actually, the American Academy of Anti-Aging. And I'm like, what is going on? I'm looking at his hair. I can't stop looking. He's like, yeah, the growth is amazing. I'm like, what are you talking about? Usually 4 months out from a procedure, those of us who've been in the field a long time, we would normally think that would be like a lot of hand holding. Hold on, just wait, it's coming, stay tuned.
Yeah. His
growth was like off the charts, the fastest healing, fastest hair growth I've ever seen in a hair transplant procedure. So I was intrigued. You got me. And so, obviously you can see some of his results on our website. You can see his particular results, Brian's results on the website. It was just so stunning. We literally sat down and did an interview right then and there. We couldn't even believe the results that we were seeing from the procedure combined with the JuveXO.
Combined with the JuveXO, it actually works phenomenal. It basically helps healing a lot faster. If you think of what exosomes do, these are signaling cues from one cell to another. And in the context of skin, it helps heal significantly quicker. So a lot of times when you have regular procedures done, even procedures done on your face, like a microneedling, radiofrequency, or anything else you may have, the healing process takes quite a bit of time. But when you apply our product to it, it's expedited, and the results are much quicker too, which is what's nice, is what you want to see.
Yeah, I wish I could tell you exactly how and why it does what it does, but obviously whatever that cellular communication that's being activated, anti-inflammatory properties, the pro-hair growth properties, really amazing technology. So thank you for inventing it and putting it forward into the world of hair loss.
Thank you very much for using it and showing that it works, because without your work, we can't actually show that it actually works. So
well, we're going to continue to do a lot of work with the JuveXO. We've already deployed in over 100 patients. We're also doing a pilot study on pushing the exosome exosomes through the skin transdermally with an ultrasound.
Which is fantastic. I'm looking forward to that. I think it's a 10-patient study that's going to be done relatively soon. So that'll be also a neat study that we're going to show you mechanistically somewhat how this works, what transpires, and ultimately it boils down to one thing. It looks good or it doesn't look good, or it worked or it didn't work.
Yeah, I mean, all the stuff we're doing with the pilot study, we're measuring exactly how much hair there is in each zone. We're looking at the AI-powered hair caliber measurements. We're looking at the cross-sectional hair bundle trichometry. So these are all very, very finely tuned metrics to know exactly what's happening at the level of the scalp in response to the therapeutic intervention. So we'll see that, we'll be tracking that. And of course, we want to see thicker, fuller, healthier hair, you know, in hopefully quick fashion. It could be 3 months, 6 months, or 9 months, but we'll be able to see everything that's going on and track those patients really closely to know what we need to do, how to deploy it. But the transepidermal delivery is really going to be key because, you know, we don't have to inject this product. We can just apply it directly to the skin, use the ultrasonic device, the TED, to push it directly through the stratum corneum, and we're getting that positive effect on the hair regrowth.
And the best part about it's minimally invasive, which a lot of people love. It's
minimally invasive.
Yeah.
The TED procedure, people fall asleep. They don't even realize that anything's happening. It's so relaxing.
Yeah, I tried it, you know, just tried a little bit on my scalp to just see how it feels, and you feel nothing. So it's fantastic. It's an easy delivery mechanism.
What sets JuveXO apart from other products in the market for hair restoration?
Well, in the context of hair restoration, our product is different because the majority of others that have exosome-based products out there just use the same exosome for A through Z. Our product's completely different. We've actually formulated specifically for hair growth. It has 2 specific recombinant growth factors in there that are designed to help better appearance in hair, increase basically, you know, stimulate the hair bulb to actually grow more hair, so ideally make it thicker.
Right.
And make
activating the
appearance.
proliferating progenitor cells.
Yes, to help with growth.
And there's a lot of different, you know, cell therapy options out there on the market. You know, some people like to use PRP, platelet-rich plasma, or PRF, you know, or other treatments that are out there. But really having something that's specifically tuned for hair in this realm is has just been fantastic.
And there's no need to draw blood. There's no need to do anything. You just thaw a vial out, use it, which makes it really easy to use.
And we have a question on Instagram. How's the best way to use it?
Well, I would say my impression so far that JuveXO H could be used in conjunction with the hair transplant procedure, as we described with Brian and others.
Yes.
How we get we soak the grafts in the JuveXO. We can apply and deploy the JuveXO into the skin either before the procedure, during the procedure, in the first couple of post-operative days, and even as a follow-on therapy to help protect the non-transplanted hair. So as a surgeon, you know, that everything that we just talked about is all about the surgery and getting the results with that. Yeah. But we can also use JuveXO to help prevent hair loss, meaning we're going to get those weaker, wispier hairs to stick around and be, you know, work thicker, stronger, and better over time as a non-surgical lunch break type procedure.
So meaning just applying it topically?
100%.
Yes.
Yeah, topically, maybe with microneedling or not, but or maybe with as we do the studies with the TED, the transepidermal delivery, sonophoresis deployment. You know, these are definitely great ways to get the treatment. So it could be as a preventative therapy, or in conjunction with something more invasive like surgery. It could be used in conjunction with a PRP. It could be used in conjunction with laser light therapy. You could combine it with topicals that you're doing at home or oral medication. So it really becomes this multimodal approach. You know, a lot of folks have been using different types of therapies for many, many years and reached maybe a plateau. They haven't gotten past a certain amount of growth. Yeah. This just adds another layer of power and strength to their treatment regimen to take it to the next level.
Yeah, possibly even similar to a serum level that they're actually adding serum topically, you know, on their scalp, drop-wise added on. It should help.
Stay tuned. Don't let the cat out of the bag. You know, we could combine it with a variety of different things.
Different things, yep.
Can you give some information on what's in it, the growth factors?
Those are proprietary blend that we can't talk because we spend years developing this platform, but it is 2 different growth factors that are specifically designed to help scalp and hair.
Is there any potential side effects or risks associated with JuveXO or the exosomes and hair restoration?
I mean, I personally haven't seen anything. We haven't seen anything. I know there's been a lot of hundreds and hundreds of procedures done worldwide with this, and there's been zero issues with it.
Yeah. So exosomes deployed in this way topically are exceptionally safe. You're not going to see any kind of adverse event or any risk with exosome therapy. There's nothing been reported to this time.
What type of protocols are you using with JuveXO?
Well, we described previously we described the protocols in conjunction with the hair transplant procedure in the healing phase, but also as a standalone therapy, and also in conjunction with like what I call hair homework. You know, it could be topicals or other medications you're taking, or laser-like devices that you're using at home.
Can you talk about the difference between the treatments for men and female?
The difference between male hair loss and female pattern hair loss?
Yeah, or the treatments. How would you go about it?
Yeah, well, first of all, if you're having hair loss, you really want to come in and get an appropriate evaluation. So that would mean a hair density measurement. We look at also risk factors like what's going on in your genetic history. Are you taking any specific medications? Or anything going on in your lifestyle? For example, nutritionally, have you had a recent surgery? Do you have hormone imbalance, or for a woman, are they going through menopause? For a man, are they using hormone replacement therapy? So there's a huge list. Are you stressed out? Are you not sleeping? Not handling all of those other factors holistically to make sure, or even scalp health, make sure your scalp health is on point, not inflamed and so forth. So really looking at the whole picture is really how we have to get started. And so depending on what we find through that evaluation, then we're going to recommend a variety of different types of therapies that may work for you. And once we have a measurement, a baseline measurement, and we start off on different therapies, well, then we can track over time. So every 90 days, we're going to do a repeat measurement. We can use the AI-powered microscope or cross-sectional bundle trichometry and track and see what's working. So it could be a part of a male or female hair loss regimen for sure.
Have you had any experience with treating alopecia, any types of alopecia exosomes?
Well, in the practice, we treat a lot of alopecia. Alopecia is a general term for hair loss. Most folks don't realize that you could have an alopecia condition just from getting hit in the head with something sharp, that you have now scarring alopecia, or a wound from a plastic surgery procedure, something like that, or an injury or trauma. Obviously, if the area has been traumatized, you have to put a hair follicle back into that area in order to get regrowth. So certain alopecias are scarring, meaning they're more permanent and need transplantation. Other alopecias might be more gradual, like male or female pattern hair loss. Those are really the ones that we want to try to work with treatments like JuveXO, to reduce inflammation, improve the health of the scalp, and then also stimulate hair regrowth.
Do you have a question? Oh, she asked you a question. Okay. What specific types of hair loss or conditions are responding better with the use of exosomes?
Yeah, I mean, we don't know exactly which conditions are going to respond better, and we don't actually know which patients are going to respond better. That's why we're doing the pilot studies, the clinical trial work, to really figure out, who are the best patients to deploy exosome therapy. But we do have a little bit of a hint. As I mentioned previously, if the area is scarred and the follicles are dead and gone, you're probably not going to get any kind of regrowth. Follicles are not there. Think of it like fertilizer in the garden, but there's no plants in the ground. That's not going to work. So the alopecia conditions that have a miniaturization effect, where hair follicles are weakening over time, or if there's inflammation at the level of the scalp that's impeding hair growth or dysregulating the hair follicle, those would be the conditions that I would think are going to work best for a variety of things. Could be better nutritionals, a good probiotic, a laser light therapy, cell therapy in the form of exosomes. I mean, those are the treatments that are going to work best in those particular cases where the hairs are there, but not yet dead and gone.
Yeah. We need something to build upon.
Yeah, for sure. For sure.
Can you speak about the microbiome that they've discovered in the scalp? We have microbiome in our gut, but now they're saying there's one in the scalp.
Yeah, I can speak to that a little bit. So the microbiome of the scalp is really important for regulating the health of the scalp. And we've known this for a long time. Overgrowth, for example, of different types of fungus, malesthesia in particular, is really the key trigger for things like seborrheic dermatitis and dandruff. And so many, for example, dandruff shampoos are antifungal for that reason. They could contain parathione zinc, or they might be containing ketoconazole or things such as that. So re-regulating that dysbiosis of the scalp, of the skin, is really, really important for hair health and scalp health. It's critical, actually. I don't think we have really good diagnostic tools for that yet, other than like looking to see if there's inflammation or flaking or dryness or measuring sebum production, things like that. But obviously we can tell when there's inflammation. We've got to go from the symptoms, what we need to do to change up the either hair hygiene regimen or apply therapeutic intervention.
If there's dysbiosis in the gut, then it's also going to affect the scalp.
Yeah, so the question is, if there's dysbiosis in the gut, how will that affect the scalp? Well, whole body inflammation is no bueno. It's not going to be good. Everything's going to be more triggered. So you could have irritation, inflammation in your face, in your scalp, under your armpits, in your ears, if you have whole body inflammation. So it's going to be very, very important to address that. That's part of the holistic approach that we do take. Not just because I have a department specifically for scalp.
Yeah.
I also have a functional medicine department in the practice at Bauman Medical. So, depending on what you might need, we kind of weave all of those things through, navigate all the issues.
All the different issues. And the great thing about JuveXO, a lot of people don't know, is speaking about microbials and dysbiosis of the gut, is the product actually has LL37. So it's one of the strongest naturally occurring antimicrobials that are out there, that are available, that you can actually basically effectively use. So one of the key things that we actually look at when we actually look at skin sometimes, commonly when you look at acne, you'll see individuals that have scarring. A lot of it is microbial in nature. So if you can eliminate the microbes from there, you eliminate the issue, and the skin can actually regenerate and heal the correct way. That's a neat thing about JuveXO and JuveXO Hair, is it actually has this LL37 peptides, and in the correct amounts, which are actually nanogram amounts.
So you think the peptide will home to the areas of concern?
Oh, it's naturally there if you're just actually putting it on the scalp. Mm-hmm. And if you have a scalp issue with microbes, especially with fungal issues, which a lot of people take for granted, sure. Sometimes you'll have, for instance, a nail fungus. And a nail fungus, when you're not really understanding that a lot of it is actually systemic. If you don't deal with the system, and if you don't deal with it, you're not going to be able to deal with that localized area. So dealing with this topically in a localized area, if there's an infection there, then there's a possibility, because we're giving you an antimicrobial, that you can apply topically to that area.
Like candida.
Correct. Any of the, yep.
It's going to fix more than just your hair follicle, in other words, right?
Yep.
Maybe,
possibly.
It'll be interesting how we sort through all of those different things, as we move along with scalp health issues, hair regrowth, different types of alopecias. I mean, we've just started to scratch the surface, I think. I mean, this is the very, very beginning of an exciting technology.
And that's why we do studies with you, and we do studies to actually understand a lot more about what is transpiring, how this actually works mechanistically based on what the product has, and then what the results are.
I would say, if there are physicians out there who have tried exosome therapy and maybe we're not too keen on the results, I would say that my impression over the past couple of years is that these products, and I'm speaking really for the whole industry, have really improved dramatically. What do you think has changed in the industry of whether it be cell biology or just in the field of exosomes? What has changed just within the past couple of years that make these products so much more powerful?
I think the products they're only as good as the cells where they come from. And that's a big key on it. That's one. Two, keeping consistent with making a product that is consistent. Because if you look at products, for instance, like just discarded tissue from amniotic fluid, etc., there's going to be variances because each baby develops completely differently. When you have stable cell lines that you're actually using and they're pure stem cells, and you know what you have, you know the properties of the cells, now you can actually play with those cells to release out and to force them to release out the right guidance cues, the right growth factors that are needed to perform the way they should perform.
I mean, the research is just exploding in this field. And so do you want to talk about the cell line in the back?
But behind JuveXO, we use actually umbilical cord lining stem cell. That particular stem cell is actually in FDA clinical studies in the United States. We spend years and years investigating. We published a paper in 2010 on it. These particular cells allow us to give us consistent product over and over and over again. Our technology is based on, we take a segment of cord that big, and we can produce 1 million doses of 100 million cells in the context of cell therapies. But when we make JuveXO, it's a different type of product. we can actually produce a significant amount of it, and there's complete consistency from lot to lot. And we've actually spent years when we developed a lot of this work. For instance, the product has hyaluronic acid in it. It has collagen 1,3 in it. It's not that we added it on, it's that we coerce the cells, these particular cells, to secrete this extracellular matrix out. And our whole body is consistent of extracellular matrix. You know, collagen 1 and 3 is the most abundant protein in our body. This product has that in there, besides the LL37, which we serendipitously found, because we're like, wait a second, when we were testing product, they thought we were spiking it with antibiotics or with other things. We're like, no, we're not spiking it with anything. Well, why is it suppressing microbes? It's been for suppressing microbes because it has LL37 in it.
So, I mean, it's naturally antimicrobial.
Naturally antimicrobial.
It's great technology.
We have a question on Instagram. Can you use red light therapy with exosomes?
Oh, well, can you use red light therapy with exosomes? Absolutely. I mean, red light therapy is a non-redundant, synergistic modality that would work great. Anything you're doing that would increase blood flow to the skin, which red light therapy does very, very well, decrease inflammation, and also impart more energy directly to the follicles so that those proliferating progenitor cells in the dermal papilla, they use a boatload of energy, a ton of energy. And so through photobiomodulation or low-level laser light therapy, you're going to impart more ATP production, which is the energy currency of the cell, and you're going to get better quality, thicker, stronger, healthier hair growth, better structure and function at the level of the hair follicles. So you can, if you're combining low-level laser light or photobiomodulation, maybe at home with a turbo laser cap, that's my favorite. You know, you can combine that with exosome therapy that we're doing in the office, great. Or maybe we eventually have something else that we could use at home as well at the same time.
How many treatments will my patients need with JuveXO?
Yeah, well, that's a great question. You know, just like with PRP, we didn't know in the beginning how long treatments were going to last in terms of their results, and it was patient dependent. Some patients were very, very lucky, and they got a year or more worth of improvement from that kind of intervention. And the others were not as lucky. They needed more repeat therapies. So without measuring, you're never going to know. So I would encourage, if you're a practitioner and you're going to deploy exosomes, you should measure, get a baseline measurement on your patients, not just like a looky-loo photo, but a measurement with some data. And then also, if you're a patient, find a practice that will actually measure and track your hair growth over time with whatever therapy you're doing. Doesn't matter. Topicals, oral treatments, laser light, exosomes. You got to measure it or you can't manage it. So we don't know, but we'll find all of that out through the clinical trials, through the pilot studies
that we're doing. Yep.
Can you tell me what's behind you?
This is actually a picture, an actual image of an exosome. A lot of people tell you that they have exosomes, but this is an actual image of one of the exosomes that we have. This is magnified 150,000 fold, a picture of an actual exosome. So this is very expensive to capture, and it's hard to capture. Maybe that's why a lot of companies maybe don't do it. Some companies will tell you you can store something at room temperature for X amount of time. A lot of times that's really hard to do because they're not designed to live in that type of environment at room temperature. So we're actually snapping a picture of following a thaw of our product, of an exosome, a live exosome.
That's super cool.
Yeah, we have a lot of pictures of those actually.
That's great.
How do I get some JuveXO?
www.JuveXO.com, I believe.
Or if you're a patient and you're out there and you got a thinning hair problem, go to BaumanMedical.com, BAUMAN medical.com. There's actually 1,000 pages of information on hair loss and hair restoration there, and hundreds of hours of video content where you can watch and learn. And of course, if you have a question, people can go to BaumanMedical.com/ask and just type in a question, and I'll get the information out to you and figure out if they're a candidate for this kind of exciting therapy.
And if you want the best of the best, this is the man to actually do it for it. So.
Well, thank you.
Amazing. Thank you so much, you guys.
Thank you.